name is Emily George, and I'm a student at Auburn University School of Nursing, and I'm going to show you how to do a head-to-toe assessment. So before you walk in the room, you want to perform hand hygiene and knock to not alert the patient. So then I'm going to walk in, and then make sure you close the door behind you or move the curtain for privacy. So, hi, my name's Emily. Can I perform a head-to-toe on you?
Yes.
Okay, what's your name?
Jessica Satriano.
And what's your birthday?
11/23/97.
And where are you?
I am at Auburn University Hospital.
Perfect. Do you know why you're here?
Yes, I'm sick. I'm in the hospital.
Very good. And who's the president?
The president? Donald Trump.
Good. So the patient's alert and oriented times 4. So I'm going to have you sit up for me. Good. Okay. So first you want to look at the face and make sure she's normal cephalic. You can palpate just to make sure she doesn't have any bumps or bruises. Can you turn your head from side to side and puff out your cheeks and show your shoulders and move your eyebrows? There you go. So that's testing a lot of the cranial nerves. So the next thing I'm going to do is pull out my pen light. And will you just follow the light for me? Perfect. And right here. That's testing cranial nerves 3, 4, and 6. And then I'm just going to have you keep your eyes straight. Perfect. So the pupils are equal, round, reactive, and light accommodating. And they're about a size 2 or 3, which is normal. So then I'm going to have you open your mouth for me and pull my pen light back out. And you want to check the tongue and the tonsils. Perfect. And then I'm going to look in your nose. Make sure you have patent ears. Anything hurting you?
No.
No? Perfect. Then I'm going to go ahead and palpate the throat and the trachea to make sure it's midline. You can check the carotid here and notice any JVD. So the next thing I'm going to do is her reflexes. So I'm going to have you swing your legs over. So the first one is her bicep. So I'm going to have her turn her arm like this. You find the tendon and you pop and it'll go up. For a tricep, you put in an angle like this. Again, find the tendon, pop, and it'll go out. For patellar, you're going to find the soft spot in the kneecap, hit, this will go out. And then for Babinski, you're going to move the toes like this, go from bottom to top. And if the toes fan out, you should alert the doctor. While I'm down here, I'm going to be assessing skin integrity the whole time, looking for any edema. I'm going to go ahead and check her pedal pulses and make sure they're +2 bilaterally. And again, just checking skin, edema, looking for moisture and hair distribution. So then I'm going to check her pulse. You always want to measure her for a full minute for the first time. And then after that, you can do 30 seconds and times by 2. You also want to make sure you're checking your pulses bilaterally to make sure it's equal in both arms. So can you grip your hands? Perfect. And can you move up, good, and push down like a car? Perfect. That's just checking her range of motion and making sure she can move her body equally. So now I'm going to take a listen to you if that's okay.
Yes.
Okay. So you want to listen for heart sounds for a full minute, and you want to make sure that you're not hearing anything other than S1 and S2, no murmurs or anything like that. Normally I would listen under the skin, under the shirt, but for privacy I'm just going to do it on top of the shirt. So I didn't hear any murmurs or anything like that. While I'm doing heart rate, I can go ahead and do her blood pressure and her temperature and look for her respiratory rate and get all my vitals in at once. I can also put an O2 sat probe on her to get her O2 saturation and complete my vitals. While I'm doing her heart sounds, I'm also checking her chest and her thorax, making sure everything is good. And you can palpate for pain like this all the way down. And now I'm going to do her lung sounds on the back. And again, you want to inspect the skin, look for any edema or lesions like that. And when you're listening for lung sounds, you want to do it in a ladder pattern. Take a deep breath for me. Good. Deep breath. Good. Deep breath. Good. So lung sounds are clear, nothing adventitious. And I'm going to palpate and you tell me if you feel anything painful, okay? The next thing I'm going to do is have her lay down and do her GI and GU. So again, normally I would listen on the skin, but for privacy, I'm just gonna listen on top. And you wanna inspect first, again, look for any distension, anything like that. And then you want to listen. So I'm going to auscultate in all 4 quadrants. Okay. And then the last thing you wanna do is palpate. So let me know if you feel any pain. This is when I like to ask my patients about their bowel movements, making sure they're regular. You want to ask post-surgery, especially if they've passed gas or anything like that, to see if the bowel's woken up. You also want to ask about their nutrition. What are they eating? Have they been able to eat? And how they're voiding. Are they using a Foley cath? Can they void by themselves? Making sure there's no burning or irritation either way. And that's it. Thank you.